Good morning, good afternoon, good evening, everyone. Welcome to this presentation about static posture and how to assess. Colleague Dalia Swick initiated a group of colleagues from different countries looking into posture and postural care. We've been discussing posture and postural care and the importance of posture, how we treat, how we assess, the short and the long-term effects of the treatment we give. We've been doing so monthly online for more than 1.5 years now and have discovered that language differs and that there are quite some misunderstandings about what posture actually is. What do we mean when we talk about posture? What is postural control? What's the difference between dynamic and static posture? Postural stability, trunk control, balance, and how do we test? So back to basics first. First things first. Presenting the tests and assessments that I'm aware of as a first guide, a discussion piece, as a first effort to collect all tests of static posture. What are we talking about when we speak of posture and or alignment? What does the dictionary say? And how do we assess? So let's see what the definition of posture actually is. Well, it depends on the dictionary you look at. As you can see, the Oxford Dictionary says it is a way the body is positioned when sitting or standing. It's the general way of holding the body in an upright posture. The Cambridge Dictionary says it is the way that somebody holds their shoulders, neck and back, or in a particular position in which someone can stand or sit. The Collins Dictionary says the posture is the position in which you can stand or sit. And the Merriam-Webster Dictionary tells us that it is the position or the bearing of the body, whether characteristic or assumed for a special purpose, a model. And the Longman Dictionary tells us it is the way you position your body when sitting or standing. Closely linked to posture is alignment. So what is alignment according to the dictionaries? It is a place to become or be placed in a line. It is to bring into a straight line. It is an arrangement in which two or more things are positioned in a straight line or parallel to each other. It is the proper positioning or state of adjustment of parts as of a mechanical or electronic device in relation to each other. It is an arrangement in a straight line. And out of alignment with something is something that is described as a bone in my spine could be out of alignment. So what do our colleagues say that posture actually is? Physiopedia is a non-for-profit organisation educating physiotherapists all over the world. They're building a community, advocating our community and helping those, all of us all over the world spread knowledge. Now, they define posture as the attitude assumed by the body either with support during the course of muscular activity or as the result of the coordinated action performed by a group of muscles working to maintain stability. They described two types of posture, dynamic and static. What is static posture? It is the rest or stay put, the posture we are positioned in. It can be in prone, supine, side-lying sit, and in specific poses. Dynamic posture requires postural control, postural function, balance, stability, and the question is going to be, how do we test? Alignment is discussed on Physiopedia, but it's not defined in any way. So I suggest looking at what the dictionary says, that it is the proper state or positioning or adjustments of parts in relation to each other or placing in a straight line. And what do our colleague chiropractors actually mean by posture? Well, the interesting thing is that they look at and talk about erect posture and spinal distortions leading to the subluxation syndromes they describe, but they also talk about the gravitational effects. They talk about stance and motion postures and the typical effects of balance defects. And they are right, because so many things influence human posture. To name a few: gravity, the environment you are in, your living space, the actual space you have, the anatomy, your anatomy, the vertebral column and your extremities, organs and tissues attached to the spinal column, the physiological state of your body and all the body systems, and your other senses such as vision, hearing, sense of body awareness and balance, pathology, your emotional state and your energy levels, pain, poverty, cultural habits, time of day, others surrounding you, and there will be more. So after this summing up of what posture is, this presentation is going to be about static posture only. And what do we need to assess posture? Why do we want to assess posture, static posture? Because static posture is like a snapshot of posture in time frames, but it can be used to create awareness of the posture, to check the spine and the thoracic cage, the extremities and their change during therapy. You can monitor by assessing it the difference between relaxed and an active posture. You can monitor it to use to see changes in time and during growth. It can help assess effectiveness of therapy given. And you can actually use it during therapy to show your patient, for example, what the posture looks like from an angle that they cannot see themselves. Static posture is how you hold yourself when you're not moving. You are either then sitting, standing, lying, or in your sleep. Body segments are aligned and maintained in a fixed position. This can be achieved by coordination and interaction of a number of muscle groups working statically to counteract gravity and other forces, or by total relaxation when supporting surfaces are perfect. Why is this important? It is important for assessing posture for patients at risk of developing asymmetric bodies, the scoliosis patient, the patient with CP, and it is important for those who have low tone and are collapsing because they cannot counter gravity. We have a number of tools to assess static posture. Most of them assess the total body posture, and some are more specific for the spine and thoracic cage. A number of these tests assess both static and dynamic posture. The posture baby scope, the posture and postural ability scale, the trunk impairment scale, a stopwatch, the DNS assessment, and the HPT translated posture movement therapy method by Elizabeth van der Meulen. Most of us have had to rely on taking pictures. So if you do have a young child and you just lie them on their stomach, for example, and you take pictures and you take a number of pictures during, say, a minute, you will definitely see different postures in different situations that can help you assess. In this case, looking at, does the spine change posture when the head does? With very young babies not staying put in any one place very long, you can imagine that taking a number of pictures while you are using the scoliometer to have a look at what the rotation aspects are can be helpful as well. The assessment of rotation of the spine is done during the Adams forward bending test, a static posture in which you then slide your scoliometer along the spine to get an idea of the rotation of the spine. The scoliometer can be used in the clinic not only with the Adams forward bending test, but also in sit if your patient can't stand. And it can be very useful to monitor changes in posture, for example, before and after a treatment. It is also a helpful tool to help you see if an X-ray is needed, yes or no. If you don't have a scoliometer, people have decided to use an app that they can download on their phone, and then they use their phone to glide across the spine. I don't think that's such a good idea because it's not long enough, and the scoliometer actually needs to measure both sides of the trunk and the rib cage, and it can't because it's too small. Better is then, if you don't have the scoliometer, the torsion bottle, as described in this article by our colleague Romano. So instead of downloading an app, it might be better to buy a scolio screen, a piece of equipment that you can click your phone into that actually turns into a scoliometer. Colleague Stolensky, who is a scoliosis expert, has developed this two-dimensional digital photography evaluation of posture, standardizing it, making it reliable for children between the ages of 7 to 10. I highly recommend you all read this article because it describes in detail how this is done, and it gives you all the information you need, free access. Infrared thermography can be used to assess static posture as well. Problems are it is expensive and the temperature of the room has to be the same all the time, but who knows in the future. The classic plumb line test can be used to see if somebody is in alignment, yes or no, and it can be used in standing and in sit. The waist trace tool can be used to assess static posture. It is mostly used with our scoliosis patients. It looks at the asymmetry of the flanks and rates it as slight, mild, moderate, or important asymmetry. The SAROM, the spinal alignment and range of motion measure, can be found in detail on the Can Child website. It was developed and intended for people with CP. It has two sections. One looks at spinal alignment and the other looks at range of motion and muscle extensibility. 4 of these descriptive tests and observational tests can be used to assess static posture. The Goldsmith Indices of Body Symmetry was developed to evaluate the effects of postural care. It provides your patient, you, with a reliable tool to measure and record body symmetry. It is found to be a reliable tool to measure thoracic shape, symmetry, pelvic and hip orientation in people with cerebral palsy. It allows for an accurate tracking of postural changes over time, especially in our non-ambulant adults with cerebral palsy. It assesses the sterno-spinal line, an imaginary line between the sternum and the spine. This line should either be vertical or horizontal depending on the posture, but if it is not, it is a prediction for more distortion of the chest. The following tests can be used to assess both static and dynamic posture. Postural asymmetry was described in detail by Dr. Voita at the time. He talked about the central coordination disturbance disorder as one that showed children with postural asymmetry. Our colleagues from Poland have looked at a way to assess this postural asymmetry using a podoscope at first. The Podo baby equipment was developed. A child is put on a flat surface and the equipment, the software, looks at the moving child, looking at both static and dynamic posture, limbs moving yes and no. And the equipment does allow you, the program allows you to stop the images later and look for asymmetries. The trunk impairment scale was originally developed for adults, but it can be used, at least the parts assessing the static sitting balance and the dynamic sitting balance, for children and adolescents with cerebral palsy as well. The Posture and Postural Ability Scale, the PPAS, is a scale that can be used to assess both static and dynamic posture. It has been found to be very sensitive to small postural asymmetries and deviations and is meant for children and adults with cerebral palsy. We are hoping that the future will be that we can add a three-dimensional camera to iPhone or iPad to assess the PPAS. The stopwatch can be used to see how long a patient can stay in a certain posture, but I would certainly also monitor the breathing in to see if there's any breath holding. The dynamic Neuromuscular Stabilization Approach assesses both static and dynamic posture. They also look at limb activation during certain postures and endurance. They look at breathing, they test the diaphragm, and look at more than only, but it is extremely functional and based on the stages of developmental possibilities of the young child. This test is described extensively by colleague Kobasova, and I would like to thank her very much for her permission to share a number of the slides that are part of that publication to show you what the test looks like. Every test starts with a description of the optimal pattern from the developmental perspective, looking, for example, at intra-abdominal pressure in this case, and looking at the abdominal bracing. It then describes the testing procedure itself, and the assessor then evaluates the amount and the symmetry of the activation, observing the abdominal contour and any sort of movement of the umbilicus in this case. So the optimal pattern of what a baby can do at a certain age, in this case, like lying on your back and being able to lift your legs against gravity in space while keeping your arms to your side, is a position that is then used as a test position for older children and adults. In clinical practice, any position can actually be used to evaluate, but the authors have described the most frequently used tests and signs that they find can be best monitored as particular test positions, and the results that are found, dysfunctional or functional, are entered into the assessment sheet. Elisabeth van der Meulen was a Dutch physiotherapist. She developed the posture and movement therapy. Elizabeth was trained in the Bagnet method. The neuromyotherapy Bagnet uses self-resistance and was developed in 1946 by Mrs. Bagnet van der Voort. The further development of the method after her death was assigned to her Dutch and French fellow workers. They published Rééducation musculaire à base de réflexes posturaux in 1968. This book was later translated into Dutch and English in 2004. The method utilizes giving resistance to fixed surfaces in closed chains, and it was especially suited for patients with paresis, paralysis and scoliosis. In her course manual, Elisabeth van der Meulen describes her method as, in the course of the years I have tried to apply the fundamentals of the Bagnet method, but with the aim of also improving the dynamic functions. A very small percentage of patients treated with physiotherapy comes with flaccid paralysis. A much larger group can also be helped on the same basis, but with a different goal and a different approach, and with activation of movement. The aim is to make the patient feel the release of muscles after contraction, using tension and relaxation in order to achieve an interplay of muscles, such that a minimum of effort is required for daily movement. She also developed a number of props to assist positioning. Posture and movement therapy includes working in closed chains in all postures as in the Bagnet method. But functional exercises have been added in both closed, semi-closed and open chains. Graded resistance is used to strengthen and raise body awareness. And goals are to be able to hold the trunk as a stable functional unit, the trunk stiffness as described by McGill, to be able to do so in symmetry and with as little exertion as possible. Also to be able to move from one posture to the next, adapting as needed and allowing head and extremities to move freely, preferably during an ADL task as homework. So, isometric strength and endurance of any posture can be assessed. The question is then, when I give resistance, how does the patient react? Can they stay in this position? Can they hold? And if they can't, where does the weakness become visible? And how do patients compensate? That has been for me a really interesting way of checking somebody's posture with this graded increased manual resistance. You could call it a posture break test. And the wonderful thing is you can do it in all postures. I would like to end this presentation by thanking everybody that has helped me gather this information, given me permission to use information from their literature or their websites. This is a first list of assessment tools for static posture. It is also a first edit with better information about the last method I mentioned. I am aware of the possibility that not all assessments and tests that are out there in the world are added because these are the ones I know about. Please help me make this list even better if you know of others. We end with the references that I have of all the articles that I've spoken about and the tests and the websites. Wishing you all a wonderful day and hoping that you have found this information helpful.